Hi, everyone. Let's get started. So we will be taking up the Lecture 1 study guide, and you can find this on eCentennial. If you haven't already watched the lecture recordings before coming to the tutorial, you should do that afterwards, okay? Because there are more information in the recordings than what we will be able to cover in the tutorial. So in order for you to do well on the test and on the quiz, you really need to have a combination of both, okay? So first question here, it says name the major blood vessels that supplies different organs. So we have the arteries going to the head, and that one we call the carotid artery. Carotid artery. Okay. Next, going to the lungs, we have what's called the pulmonary artery. Okay, so when you think about artery, you sort of think about these as blood vessels that carries oxygen-rich blood, but that's not always the case. In the pulmonary artery, for example, it actually carries oxygen-poor blood. You're taking these oxygen-poor blood to the lungs, where you are going to be able to reoxygenate them. For the heart, we have the coronary artery. If you block one of these coronary arteries, you might have a heart attack, or you might experience chest pain or angina when you physically exert yourself. So more on that later. Going to the kidneys, we have the renal artery. Okay, so from the abdominal aorta that comes down, it will branch to both sides of the body, creating the renal artery. I'll show you on a diagram in a second. Next, we have the liver, and the liver is supplied by the hepatic artery. Okay. Now, each of these has a counterpart, the veins. Okay, so for the head, coming back down from the head, we have what's called the jugular vein. Okay, the jugular vein, it's right here. Okay, the lungs, it's the same. Everything else is the same. It's just the first one that's a different name. So we have the pulmonary vein. We have the coronary vein, renal vein, and last but not least, we have the hepatic vein. Okay, so these are the key vessels that I want you to know. There, of course, are other ones, right? Going to the legs, for example, we have the femoral artery and veins, but these are the key ones that I want you to know for this lecture. Okay, this is the path for blood flow. So as you know, it's a continuous cycle. So there's technically no beginning or end, but usually textbooks describes it by starting at the superior and the inferior vena cava. All right. So the superior vena cava and the inferior vena cava will collect blood from the upper part of the body as well as the lower part of the body, and that will feed the blood into the right atrium. Okay, and just to give you a quick refresher in case you forgot, if you look at the hearts from the front, there will be 4 chambers. The right atrium is here, left atrium is here, right ventricle and left ventricle. If you're looking at the heart from the front, it's a mirror image, right? So that's why the left side on the paper is actually the right side of the heart. Okay, so this is front view or anterior view. Okay. So the superior vena cava will come in here, gives the blood to the right atrium. Inferior vena cava will do the same. And from the right atrium, it is going to go through the tricuspid valve. The tricuspid valve has 3 flaps. That's why it's called tricuspid. And it's going to be found between the right atrium and the right ventricle. Okay. So from the right ventricle, we will then pump the blood through the pulmonary valve, which is located just at the entrance of the pulmonary artery. Okay. And it will take it to the lungs, where you will reoxygenate it. You will get more oxygen into the blood. You will remove the carbon dioxide from the blood. And then you will return the blood to the heart through the pulmonary vein. And that will go to the left side this time, the left atrium. There's another valve here between the left atrium and the left ventricle. Okay, it's related to the tricuspid valve, but this one only has 2 flaps. So we call it the bicuspid valve. Bicuspid valve. Okay, some textbook also call it the mitral valve, but I'm gonna stick with this name. Which would then go into the left ventricle. And from there, it will go through the aortic valve, and then we'll go into the aorta. And then the aorta is going to distribute the blood throughout the entire body. So I'm going to say body here. Okay. And ultimately is going to go back to the heart through the superior and inferior vena cava. Okay. So actually, you know what? I'm just going to put the other name here in case you come across it. Mitral valve. Does anybody have any questions so far related to the flow here? Okay, so if you have a highlighter or some kind of markers, we're gonna highlight some of these things. So I'm gonna choose pink, and pink is going to be oxygen rich. Okay, O2 rich. It's high in oxygen content. I'm gonna have blue here. That will be O2 poor, low in oxygen. Okay, it's not like 0 oxygen, it's just very, very low, right? Okay, so these blood, some vessels, some chambers are gonna be carrying oxygen rich blood, other will be carrying oxygen poor blood, and you know we have to know which is which, right? So having gone through the body, the oxygen has been deposited in your tissue, and so when it's going back to the heart, it is going to be oxygen poor. Okay, so the superior vena cava and the inferior vena cava, they will be carrying oxygen poor blood, and it will continue to be oxygen poor until you get to the lungs, right? Okay, so right atrium is going to be oxygen poor. Tricuspid valve is just a valve, so you know it's not going to have any blood going in it. It's going to be going through it, right? So we're not going to highlight that. The right atrium is going to be oxygen poor. Okay, another valve, and pulmonary artery is going to be oxygen poor. Once you get to the lungs, they will turn from oxygen poor to oxygen rich. Okay, so we go from blue to pink, right, with our color code here. And then it will be oxygen rich all the way. Okay. And then when the blood goes through the body, it's going to go from oxygen rich to oxygen poor because you're using up that oxygen, right? Okay, and then the cycle repeats itself. Now, I'm going to use another set of colors for highlighting the valves. So the tricuspid valve and the bicuspid valve, they belong to the same group. Does anybody know what they are called collectively? The tricuspid and the bicuspid, what do we call them collectively?
Atrioventricular valve.
That's correct, thank you. So that would be the atrioventricular valve or the AV valves, okay? So these tricuspid and bicuspid valve, they will open and close this together in sync. The other pair that we have, of course, is the pulmonary valve and the aortic valve, okay? And they belong to another set of names, which is?
Semilunar valve.
That's correct, thank you. That is the semilunar valve. And the semilunar valves will be opening and closing together with each other, okay? But the AV valves and the semilunar valves will always be out of sync. So let's say this hand represent the AV valves and this hand represent the semilunar valves. When the AV valves open, semilunar will be closed. When the AV closes, the semilunar will open. So they will always be out of sync with respect to each other, okay? But the valves of the same category will always be in sync. Is this okay?
Yes.
Okay, thank you. All right, moving on, next part here. We have a chart here that talks about various characteristics, and we want to know whether we're talking about the artery or the vein. So first thing here, higher blood pressure. So does artery have higher blood pressure or vein has higher blood pressure? Well, the arteries are going to be closer to the heart, right? So in general, closer to the heart means higher pressure. Okay, so arteries would generally have higher pressure than veins. Thicker vessel wall, right? So just going along the same line, if the artery has very high pressure within itself, then you would need to have a thicker wall to prevent it from bursting, right? Okay, if the wall is very, very thin, then it's easy to rupture with high pressure. So that's why thicker walls, artery. Okay. Next one, larger lumen diameter. Lumen is the inside of some kind of a hollow structure. In this case, it would be the blood vessel. So like, if this is the blood vessel, the inside right here, that would be the lumen. Okay, so which one has a bigger lumen? Is it the artery or is it the veins? What do you guys think?
Vein.
That's correct. The veins would have a bigger lumen. Okay, so this would be the blood vessel, right? And that here would be the lumen. And veins would have a larger lumen. Okay. Veins, they also have valves. The valves help prevent backflow. It helps the blood to return to the heart, as we will see in a bit. Okay. Higher velocity. Hold on. Oh, sorry, I forgot to turn on the live transcript. Give me a second. Is it on now? The person who just requested. I hope it's on now. Okay, so blood has higher velocity. Okay, is it artery or is it vein? And again, right, like the closer you're to the heart, because of the high blood pressure, it tends to squeeze the blood forward faster, and therefore the arteries would have higher blood velocity. Okay, higher speed. That's what velocity means, right? And carries blood away from the heart, that would be artery as well. Okay, A for away, right? So there you have it. Those are some characteristics associated with arteries and veins. Let's color this thing. Label the chambers of the heart. Use blue and red to indicate the O2 level. Remember, we are looking at it from the front, and this is a frontal section, a section that you cut, this way, so it separates into front and back. And so over here we have the right atrium. Okay, we'll use blue and red to indicate the O2 level. So on the right side of the heart, it is going to be blue blood, oxygen poor. So right atrium, O2 poor. Below the right atrium is going to be the right ventricle. I just have a warning on my computer saying my internet is unstable. If I got cut off for some reason, just stay there. Okay, I'll come back for sure. So hold on, let me see if I can fix this thing quickly. Okay. Is the caption thing still working? Can you guys see the caption for those of you who are using the caption? Yeah. Okay. I think I'm reconnected now. Okay. Let me know if I'm starting to get cut off. Okay. All right. Where was I? So on the other side, we have the left atrium and the left ventricle. Okay, and these are going to be O2 rich. Okay, what separates the blood from mixing together? What is the structure that separates them? This thing right here, what do we call that?
Septum.
That is the septum. Okay, so we need to separate the oxygen-rich blood from the oxygen-poor blood. If they start mixing, then we will have less oxygen content in the blood that we deliver, and there will be consequences, right? You might experience, fatigue, shortness of breath, so on and so forth, right? So we don't want that. That's what the septum is for. That's why it's important. Next, label the structures leading to and away from the heart. Use blue and red to indicate O2 levels. Okay, so we can see up here we have the superior vena cava. And just zoom in a little bit here. That is the superior vena cava. Which collects blood from the upper 1/3 of the body. And over here we have the one that's collecting blood from the lower 2/3 of the body. That would be the inferior vena cava. Okay. Over here we have the pulmonary artery taking the blood to the lungs. So pulmonary artery. Okay. And just to reiterate what I was saying earlier, if you think about like a person, right? There's the person. The heart is up here. Okay, and so everything that's above the heart, that's going to be collected from the superior vena cava, and everything that's below that point is going to be collected through the inferior vena cava. All right, so pulmonary artery, it takes it to the lungs. Okay, and over here as well, right? So this goes to the left lung, this goes to the right lung. Coming back, we have the pulmonary veins, which would be rich in oxygen now. So pulmonary vein from lungs, and you have another one over here. Pulmonary vein. Okay. Finally, we have the aorta. Now you cannot really see this, but it's important to know that the aorta will, well, first of all, it branches into 3 little smaller ones. This will go to the right side of the body, right? This will go up to the head, and this one will go to the left side of the body. But this will arch back and continue. You can kind of see a little bit of it. Maybe I'll color it for you. So it's a little bit more obvious. Where's my coloring thing? Okay, so this is the aorta, right? And it continues here, right? And behind these stuff, it will continue to go down, okay? And then it will come down from here. It will exit from down here, okay? So that right here is going to be your abdominal aorta. Okay, it's gonna go through your diaphragm. Do you guys know diaphragm, right? The muscle that separates your chest cavity from your like all your guts, right? So it will go through the diaphragm right here. Okay, and the blood will go down. Okay, and for those of you who are interested, well, we'll learn this later. Okay, but just to let you know a little bit ahead of time, this will branch into the left and right renal artery, right? Which then goes to your kidney. All right, so there you have it. Those are the major vessels. Okay, remember that these are going to take the blood to the right side of the body, up to the head, and to the left side of the body as well. Are we okay? Does anybody have any question? Okay, thank you. Label the 4 valves of the heart. All right, so we've done that before, but let's do it again. We have the tricuspid valve on the right here, separating the right atrium and the right ventricle, of course. So that is the tricuspid. 3 flaps. Okay, and on this side we have the bicuspid, 2 flaps. Okay, and of course together they are the AV valves. Choose a different color here for the pulmonary valve. Okay, pulmonary semilunar valve, right? Okay, and over here we have the aortic valve. All right, so together they are semilunar valve. These ones, AV valve. Next, we're going to trace the path for blood flow. We're going to start at the vena cava, which is plural for vena cava. So starting from the superior inferior, it will go over here, right? The right atrium, go down the ventricle, and then the ventricle will squeeze, and the blood is going to go through the pulmonary artery like that. Okay, so this goes to the left lung. This goes to right lung. And then the blood will come back through the pulmonary veins, okay, from left lung. Over here will be from the right lung. Then it will feed into the left atrium, down to the left ventricle, and then go up here around the aorta. Okay, of course, the blood is going to go up to the head and to each side of the body. And I just told you the aorta will come down here as well, right? Just gonna draw that in one more time for you. There we go. So that's the flow. All right, you should know the flow. It's quite important that you do. Let's do a poll question and see how it goes over here. I have to find my poll button. Give me a second. Go ahead, please. Okay, most of you got it right. Most of you chose C, which is perfect. Now, if you're not sure what the answer is, you can just go back to what we drew just a little earlier, right? This path here, and you can see that the left atrium, right? What's feeding into the left atrium? That would be the thing that's before it, right? So the answer would be the pulmonary vein. Okay, pulmonary veins from the lungs will feed the oxygenated blood into the left atrium. Okay, so expect questions like that on the quiz. Moving on. List 3 factors that affects blood pressure. Briefly describe how each affects blood pressure. So help me out here, guys. What are the 3 factors that we talked about in lecture? Anyone?
Total blood volume.
Total blood volume, that is correct. That's one of them. Let's write that down first before I forget. Total blood volume.
Thickness of the vessel.
That's right. Total blood volume first. Sorry. Total blood volume. Tina said stroke volume. Yes. And another person said the vessel diameter, right? I think that's what I heard. That is correct. Okay, so these are the 3 factors that we talked about that would affect blood pressure. But of course, there are like so many other factors, right, that we didn't go into, but these are the ones that are in the PowerPoint. So total blood volume, generally speaking, higher blood volume equals to higher blood pressure. Right? The more volume you have, the more pressure there will be within the vessel. Okay, so what is blood pressure? Right? Let's just quickly refresh your memory of what that means. Right, the pressure is basically the force of blood pushing against the vessel wall. Right? The more volume you have, the more blood is going to be pushing, the higher the pressure. Okay? So people who suffer from high blood pressure, one of the medication that they might have to take is what's called a diuretic. Diuretic, or sometimes more commonly known as the water pill. Does anybody know what that is? Has anyone heard of diuretic? Yeah, what does it do? Do you know?
Make people with high blood pressure go to the bathroom.
Yeah, that's exactly it. Right.
Yes.
So this makes people go to bathroom more frequently. Okay, so more frequent. You know what? I'm just gonna put it easily, okay? Pee more. Okay, it makes people pee more. By going to the bathroom more frequently, by peeing more, you are reducing the water content in your body. Therefore, it will lower the total blood volume, and then it would lower the blood pressure. Okay, so that's just one way that you can help lower blood pressure. There are other ways which we will learn when we get to the kidney units. Next, stroke volume. What is stroke volume, right? I'm just gonna help you define that in case you've forgotten. Stroke volume is the volume of blood ejected from the ventricles per squeeze. Okay, so the more blood you squeeze out, the higher the blood pressure, right? That's the relationship. Okay, so higher stroke volume equals to higher blood pressure. Okay, vessel diameter. We have two scenarios here. Right? We might have vasoconstriction. Okay? Vasoconstriction means you're squeezing on the blood vessel, right? So you will have smaller diameter, which means higher blood pressure. On the other hand, you might have vasodilation, which is larger diameter, which means lower blood pressure. Okay, so those are the three factors. Of course, there are things that you can do that would affect these things in directly, and so those things would indirectly affect your blood pressure. For example, if you're nervous, right, your blood vessels might become smaller, and that could lead to a higher blood pressure. Okay, when you're in scared or in danger, sometimes blood vessels can constrict, right, and that could elevate your blood pressure. Okay, by drinking more water, for example, that would affect your total blood volume, which would then affect your blood pressure indirectly as well. Okay, but these are the three factors that we talked about in class. Moving on, we have number 9, list 2 problems that needs to be overcame for
Professor,
venous return. Yes, is there a question?
I have a question. I have a
Please.
question.
Mhm.
If a patient have a high blood pressure, in that time, if he takes like more water, in that case, the blood pressure will be decreased or not?
It's not going to be like an immediate effect, right? Like the person would have to continuously intake like more water and hold it in their body, for example, for the effect to come out, I believe. Okay, it's not something that's going to be immediate. But on the flip side, if a person is severely dehydrated, then the blood pressure can drop dangerously, right? And that could lead to a more immediate effect. Okay, but it's not like if I have high blood pressure and then I drink a glass of water, then my BP is going to go up. Okay, usually it's the other way that's more drastic, right? You go out on a hot day and you sweat all for like an hour or 2 hours and you don't replenish your fluid, then you might see your blood pressure start to drop. Does that answer your question?
Yeah.
Okay, thank you. So 2 problems that needs to be overcame for venous return. What is venous return? Okay, venous return is basically returning the blood. Returning blood to the heart. Now that's going to be a little bit of a problem because the heart is, quite high up in the body. So everything that's below that level, that line that I drew earlier, they're going to have to go upwards against gravity. Okay, so that's the first major problem that we have to overcome. Number 1 is gravity. Okay, so blood has to go against gravity. And in order to do that, okay, we rely on skeletal muscle. Skeletal muscle pump. Okay. So let me try to draw this out. There is, for example, like a vein in the leg, and surrounding it is going to be some, leg muscles. Okay, these are muscles. There's a much nicer picture in the in the PowerPoint. Okay, if you need to see it. Okay, there is your blood vessel. You know what? Maybe I'll draw the vein in blue right here. There is your vein. Okay, and then you might have a little bit of blood here trying to go back to the heart. All right. So every time you contract your muscle, the muscle will squeeze. Okay, and that will squeeze on the vein, which then cause the blood to go upwards. Okay, so that's what we call the skeletal muscle pump. If you've ever been on like an airplane, long flight, right, and then you just take off your shoes and went to sleep for a long time, and then when you wake up, you try to put your feet back in the shoe, it might not fit as well as before. It will feel a little bit tight. And part of the reason for that is because when you number one, when you fall asleep and you don't move, there is no muscle contraction, so the blood is not going to be returning to the heart as quickly, so they tend to pull in your feet and cause your feet to swell up. And that effect is particularly obvious and exaggerated when you're high up in high altitude, and so moving the muscle is quite important to counteract the effects of gravity and to return the blood to the heart. What's the second problem that we have to overcome? Anybody remember?
Low pressure.
Low blood pressure. That's right. So low blood pressure. Okay, because we are in the veins now, okay, really far away from the heart, and the pressure here is substantially lower than what we had in the arteries. And fluid such as liquid and gas, in this case, we're talking about blood, of course, they don't move very quickly when the pressure is low, okay? And so they become very stagnant, right, we say. And so what happens is we need to have a little bit of valves, okay? So we're going to put some valves within the veins. Okay, so there's valve here, there's valve here. So the blood goes up, it might not be able to go all the way up, and it will fall down, and the valves will catch them. Okay, so next time you will be able to start from a higher spot, okay, closer to the heart. You don't have to start all the way from the bottom. Okay, so having the valves will help, and it will also help if there is if we create a pressure difference between veins and right atrium. So in the veins is about 15 mmHg, millimeter mercury. That's a unit for measuring pressure in blood. And the right atrium, when the right atrium relaxes, it's close to 0. Okay, so even though it has low blood pressure in the vein, as long as there is another point in the body that's lower, it will tend to move towards that direction. All right, so those are the two factors that we need to consider when we're returning blood to the heart. All right, next we have a calculation question. So a patient has a breathing rate of 30 breaths per minute. That doesn't actually matter for what we're doing, right? We don't need to take that into account. There's a heart rate of 70 beats per minute and stroke volume of 80 milliliter per beat. Calculate the cardiac output. Okay? Does anybody remember the cardiac output formula? Cardiac output?
Heart rate multiply stroke volume.
That's correct. Thank you. So heart rate multiplied by stroke volume. Okay, so in this case, the heart rate is going to be 70 beats per minute. 70 beats per minute multiplied by the stroke volume, which is 80 mils per beat. Okay, so we can go ahead and cross out the beats here. 70 times 80, that is 5600 milliliters per minute. Okay, so to convert this into liters, you divide it by 1,000. So that's 5.6 liters per minute. That would be the cardiac output. Now, is that like a good cardiac output or is that bad cardiac output? It's hard to tell. Okay, like without other information, we don't know. Okay, so maybe it's good if this is a older person, right? But maybe this is a really young person, maybe not so good. We can't really say without, you know, other background information. But that's how we calculate it. All right. You can expect to see, you know, at least one of these calculation questions in the quiz. Is everybody okay with the calculation? All right, next part here, the osmotic pressure and the blood pressure. Now, this is a complicated concept, and I spent a great deal of time explaining it in the video. So please go check it out if you haven't already. All right. So let's try to summarize it in this chart. Okay, about osmotic pressure and blood pressure. First of all, these are two opposing forces that controls what leaves the capillary and what comes into the capillary. Okay, they are against each other. So what exactly is osmotic pressure? I'll give you the definition first and then I'll explain it further. Okay, so osmotic pressure is created by solute concentration gradient. Gradient just means difference. Okay, if you took looking at 2 points, if one side has higher solute concentration than the other side, we say there is a gradient. Okay, you can use the word gradient for other things like high pressure at one point, low pressure at the other. We have a pressure gradient. Okay? It just means difference. Right. So if you have 2 points and they have different solute concentration, then there is a gradient, and that creates osmotic pressure. And what that means is the fluid, okay, fluid is the water component, is the liquid component of blood, right? So fluid will move towards higher solute concentration. Okay. Oh yeah, yeah, Donna. When did you buy the workbook? Did you buy this semester? Like just now at the bookstore, or did you buy it from before?
Yeah, I got it just this semester when it came up that they had 10 copies left. I purchased one, and for number 11, it has true or false questions.
They still have a workbook at the bookstore.
They did at the when you initially uploaded the page. You were one of the first two, and I checked, and then they still had the workbook when I purchased it. But the number 11 is different, so I'm just wondering. I'll have
to there is a few extra chart that I have inserted. So you for the most part, your book is very similar to what I have. But it's just that I inserted a few extra questions here and there. Sorry about that. But you can find these extra stuff on the document that I posted, right?
Okay, I'll just double check from now on when you post your work.
Yeah. Sorry, but I thought they sold out already, like all the old copies. I guess they still have a few more.
Quick ones, I guess, got it.
And I see Tina also got one. Yeah. Okay. Okay. So solute concentration difference, right? Let's make sure that we understand what solute means. Okay, very simple. Is if I have a glass of water and then I add some salt in it, mix it together, I get a solution, right? So in that solution, the water is the solvent, right? And then the salt would be the solute. Okay, so the more salt you add to it, the higher the solute concentration. Now I want you to visualize this. We talked about this last semester, okay? I don't know if you remember, but you know what? Let's just talk about it again. There's one thing teacher likes to do is they like to repeat themselves. So here we have two chambers. Okay, I'm gonna put some solutes into each of the chambers. Okay, you know what? Let me just pin this thing. So I'm gonna use these red dots to represent the solute. Okay, we're gonna have solute, solute, solute like that. Okay, and then just a few dots here. Okay, so these red balls, they are solute. Okay, so over here we would have higher solute concentration. And over here we would have lower solute, right? Okay, basically solute is just things that are dissolved in the solution, right, in the water. Now there is a membrane here, right? The membrane only allows fluid to pass, right? So only water to pass through. So which way will the fluid go? Will the fluid go to the left or will the fluid go to the right?
Fluid go to the left.
Go to the left. Okay. Let's do a poll. Okay. Let's see. If you think it's gonna go to the left, then say A. Okay. If you think it's gonna go to the right, do B. Okay. So A is to the left, B is to the right. And if you're not sure, just pick something. Okay? You have a 50-50% chance. Okay, so 2/3 of you said to the left and 1/3 of you said to the right. And the correct answer is it will go to the left. Okay, because fluid will move towards the higher solute concentration, right? And this is not difficult to relate to, I guess, right? If you take a teaspoon of salt and you put it in your mouth and hold it there, after a minute or two, you'd be like drooling all over the place, right? That's because the salt, which is very high in concentration, will suck the water out of your cells, right? As the water moves towards the area that is higher solute. Okay, so with that illustration, I hope you understand why water, the fluid, will move towards the higher solute concentration. Okay, I think some of you choose to the right because you might be thinking, oh, the concept of diffusion tells us that things go from high concentration to low concentration, right? But the key thing here is that the membrane will only allow the water to move. It will not allow the red balls to move. Okay, so the water will move to the left and balance out the concentration. Does that make sense? I hope I have explained that okay. So the effect on capillary exchange, what does it do, right? So I'm going to come down here and draw another picture. There is your capillary. Okay. And it's going to be a little bit leaky, okay? So fluids can actually move in and out. Not blood. Blood don't move in and out. Okay, the blood cells, they will remain within the vessel, but the fluid, the water component can move in and out. Okay, so this end, we will call it the arterial end, the end that is connected to the arterial, and this would be the venous end. Right? And what happens is you will have a bunch of stuff that is dissolved in the blood. Okay, so there are a bunch of these things that are dissolved in the blood, and these things, these dots, could be things like electrolyte. Do you guys know what electrolytes are, right? Like sodium, potassium, right? Calcium. It could be electrolytes. They could be proteins, right? And even the cells, the blood cells, would contribute to a little bit of the solute. Okay, collectively, all these things are going to be bathing within the the water essentially, and they all contribute to the solute concentration. Now, in general, the solute on the inside is going to be higher than outside. Okay, so with that, we have a solute concentration gradient, right? And that creates the osmotic pressure that will be drawing the fluid into the blood vessel. Okay, and the pressure is pretty much the same as you move from one side to the other. So the effect on capillary exchange is that it will draw it, as in the osmotic pressure, draw fluids into the capillary. Okay, and it's the same OP, same osmotic pressure on both sides. It's not going to change, right? It's not going to go up, it's not going to go down, because the content of the blood is very similar from one end to the other. Does anyone have any question about osmotic pressure before I move on to blood pressure?
So we can say that if the solute, if we have high solute on the vessel, we have high osmotic pressure.
Yeah, so if the outside does not change and you increase only the inside, then you will have higher osmotic pressure, right? Okay. So for example, if someone takes in a lot of salt, right? Okay, salty diet, that could further increase the solute concentration inside, and that would help them retain fluid, right? And then which in turn could increase blood pressure, for example. Okay. All right. Anyone else? Last call before I move on to blood pressure. Blood pressure. Okay, so blood pressure is created by basically ventricular contraction, right? When the ventricle contracts, that's creating the blood pressure, the push against the vessel wall. So ventricular contraction. Okay, and as I mentioned earlier, it is the force of blood pushing against the vessel wall. So just like a water hose, right? When you turn on the tap, pressure is high inside, and if you poke holes along the hose, then the water is going to come out, right? So similarly, the blood pressure, the effect would be it will push fluids out of the capillary. Okay. So this here, the arterial side is closer to the heart, therefore it's going to have higher blood pressure. So it's going to be pushing quite hard. Okay, but as you move further and further away from the heart, the blood pressure will drop, and so it will be pushing with lesser of a degree. Okay, so it will be pushing with less force. So over here, BP, blood pressure, is higher on the arterial side than it is on the venous side. Okay, venous side. Okay, so because the blood pressure is higher than the osmotic pressure over here, it's like a tug of war, right? Remember, there are opposing forces. So the blood pressure would be having greater than effect. You would be pushing out more fluid than you're able to bring in. So you would have a net loss of fluid, but on the other side, you'll be bringing in more fluid than you're pushing out, so you would have a net gain. Okay, but if you remember from the lecture, they are not the same. You actually end up losing more than you're able to bring in, so there will always be some leftover fluid that is in the tissue, and that actually is important for another reason that you will learn next week. So that's it. Are we okay? All right. Let's do another poll. Go ahead. Oh, sorry. Hold on. Launch the poll. There we go. It's saying select all correct statements. So you're gonna have to do more than one answer. Okay, I'll give you another half a minute or so. All right, it looks like 2, 3, 4 are quite popular choices. Let's find out which ones are correct. The bicuspid valve divides the right atrium and the right ventricle. That one is not correct because it should be the tricuspid, right? Okay, next one. Aortic and pulmonary valves prevents the backflow of blood into the atria. So if you look at the diagram here, or if you look at the blood flow chart that we have, the aortic valve is here, and before the aortic valve is the left ventricle. Before the pulmonary valve is the right ventricle. So valves, they always prevent the backflow of blood to the thing that's before it, right? So before the pulmonary and before the aortic valve are both ventricles, which is why this is going to be incorrect. Okay, that would be ventricles. The tricuspid valve separates the right atrium from the right ventricle. That is correct. The AV valves prevents backflow of blood into atria during ventricular contraction. So once again, we will look up the AV valves. Okay, so AV valves are the green ones, and before each of the AV valve would be the atrium, right? So they would be preventing backflow to the atria, which means this is correct. All right, so the correct answers are 2 and 4, C and D. Let's do another one. I'm just gonna keep on using this poll. just choose one correct answer, okay? Even though you can select multiple, there's only one correct answer for this one. So go ahead, please. Yeah, this one should be pretty self-explanatory. We did it just a moment ago. It would be number 4 right here. You should also know the unit for each of these things. So cardiac output, it's milliliters per minute, for example. You should be familiar with that. Okay, another one. Go ahead, please. This one has multiple correct answers. Okay, I'll leave it at that. So let's see. You will want to increase blood pressure in this case. Right? So decrease in total blood volume. Right? The more blood you have, the higher the blood pressure, right? So that is not it. And then that means this one is correct, right? This increase, oops, sorry. This one. If you increase the blood volume, you will increase blood pressure, right? They're just opposite of each other, right? So if this is wrong, this has to be right, right? If you reduce the vessel diameter, if you're squeezing on your blood vessel, vasoconstriction, that will increase the blood pressure. We wrote that down earlier. And so this is wrong. Increase cardiac output. You can increase cardiac output by increasing heart rate or increasing stroke volume. So we know that increasing stroke volume will increase blood pressure. So that is the correct answer, and that's not it. So B, C, and E. Okay, that's that for now. Why don't we take a 5-minute break, and we will continue in a bit. Okay, so we'll continue at 38. Let's make it 1:40. Okay, we'll continue at 1:40. Okay, see you in a bit. Okay, let's keep going. Where were we? Okay, next one. Number 12, state whether each of the following statement is true or false. So, first one. The tricuspid and the bicuspid valve are both known as the atrioventricular valve. That is true. We talked about this multiple times already today. The next one. The pulmonary arteries take oxygen-rich blood from the heart to the capillaries in the lungs. That is false. If you're taking the blood to the lungs, then they actually would be oxygen poor, right? Not oxygen rich. So that's a mistake. Sorry, guys, I'm having a loxygen in my mouth. I just don't want you to think that I'm being rude and sucking on candy or something. Yet yesterday was actually my first day back on campus. I had like 2 back-to-back class, and I think I might have been like overly excited and talk a little bit louder than I should, so I kind of lost a little bit of my voice. So if you hear me chewing on something, it's just a lost it. Okay, so apologize for that. Next one, the stroke volume. A stroke occurs when one or more of the coronary arteries are blocked. Is that true or false? What do you guys think?
Yes, I think so.
Yeah. Okay. Anyone else want to try that?
True.
True. Okay. Let's do a poll on that one. That one usually is tricky. If you think is true, hit A. If you think is false, hit B. Anyone else? Just choose something. There's only 2 choices here. Okay, a lot of people say true, but actually this is not true. Okay, a stroke is when you have a clot in the brain, right? Not necessarily the carotid artery, right? Yeah, yes, true. It could be the carotid artery, but it could also be some vessel in the head. If you block the coronary artery, you're gonna have a heart attack. Okay, heart attack. And the fancy term for heart attack is MI, right? Myocardial infarction. Right, so this is false. Okay, now you know. The AV node is also known as the pacemaker of the heart. The pacemaker sets the rhythm of the heartbeat, right? And that is not the AV node. It is the SA node. The systolic pressure is the pressure in blood vessels when ventricle relax. That is false. It should be when the ventricles contract. Osmotic pressure will increase if blood sodium level drops. I explained that earlier today. It's actually the other way around. If sodium level increases, that will cause more fluid retention, right? Because the solid concentration is higher on the inside, it will draw in more fluid. So therefore, this statement is false. So only the first one is true. Everything else is false. Any particular questions about any of these statements? Do you need me to clarify any of them, or are you good? Okay. Moving on. Sketch the following graph. So in the PowerPoint slide, there are 2 slides with a bunch of graphs on it. And that's basically what this is. This is asking you to do. So we want to describe the relationship between blood pressure versus vessel type. So here we go. I'm just going to draw the graph. And on the y-axis here, we have blood pressure. On the x-axis, we would have artery, capillaries in the middle, and veins. Okay. So generally speaking, blood pressure and vessel type, you will have the highest blood pressure at the beginning, and then it's going to come down like that. In the PowerPoint slides, the diagram, the graph actually shows a little bit of fluctuation at the beginning, right? Okay, so these fluctuations are caused by ventricles contracting and relaxing. Okay. So when the ventricle contracts, the blood pressure goes up. When it relaxes, it comes down. Okay, but eventually, when you get far enough from the heart, then the blood pressure will not be affected by the contractions or relaxation anymore. Okay. Next, velocity versus vessel type. The speed, the velocity of blood flow depends on two factors. Right? Depends on, what are the two factors that it depends on? Does anybody remember?
Blood pressure.
Blood pressure, yeah. Anyone else for the second one? What else does it depend on besides blood pressure?
Diameter.
That's right, diameter. Thank you. Okay, so generally speaking, the higher the blood pressure, the faster it's gonna go, right? Okay, so high BP, oops, high BP equals faster. And for vessel diameter, larger equals faster. Right? Think of a highway with multiple lanes. Traffic is gonna go faster than if you only had a single lane, right? Okay, so artery, capillaries, veins. This is the velocity, the speed. Okay, so it tends to be really fast, then comes down, slow down, and then it goes back up again. Okay, so arteries, they are high blood pressure, even though the diameter is a little bit smaller, but the high blood pressure would compensate for the smaller diameter, so it's still going to end up pretty fast. On the other hand, the veins, right? They have low blood pressure, but they're bigger. Right? So the larger diameter compensate for the speed for the low blood pressure. So it's comparable, but it's still going to be a little bit higher at the arteries, and it's going to be the slowest at the capillaries. Okay, so blood must slow down enough for diffusion to happen. Okay, so slowest at the capillaries. And the last one here, cross-sectional area versus vessel type. Cross-sectional area is just like how much area the vessel would cover. And, you know, we're gonna have the A, C, and V here, and that would be the area. And the graph looks something like this. Okay, so capillaries, if you take into account all the capillaries you have in the body, they would cover the most area. Okay, the arteries, they are big, but you don't have a lot of them, right? So collectively, they do not cover as much area as capillaries. Okay, so those are the three graphs related to what we're talking about. All right. Moving on. Fill in the blanks. 3 layers of the heart wall, starting at the deepest layer. So the layer that is going to be in direct contact with the blood, that would be the endocardium. Okay, followed by the myocardium. It's too thin, the pen. Give me a second. Myocardium. Okay, so that basically is the heart muscle, right? Heart muscle. And it's the thickest layer of the heart wall. And outside of the myocardium, you would have the epicardium. So endocardium is going to be touching the blood. The muscle is the myocardium, And the epicardium will be continuous with the double layer membrane that surrounds the heart, which is called the pericardium. Okay, that's the double layer sac that goes around the heart. It kind of protects the heart, anchors the heart. The pericardium has two layers. It has the outer layer, which is called the parietal layer. Okay. And then the inner layer, which is the layer that it's continuous with the epicardium, that's the visceral layer. Okay, so these two are continuous. Name two atrial ventricular valves in the human heart. You should know this by now, right? We've done this many times already today. And the answers would be, if I can find the right color again, where is it? It would be the tricuspid valve on the right side and the bicuspid on the left side. Name two semilunar valves. We have the pulmonary and we have the aortic. Something has the thickest myocardium of all the heart chambers. Which chamber has the thickest muscle? Right atrium, left atrium, right ventricle, left ventricle, which one?
Ventricles has the.
Which one? The left one or the right one?
Left one.
The left one, that's correct. Okay, because the left ventricle has to pump hard enough for the blood to go through the entire body, right? The right ventricle doesn't have to do as much because the lungs are just nearby, right? Ventricle. The right atrium collects blood from the superior vena cava and the inferior vena cava, whereas the left atrium will collect it from the pulmonary vein. Natural pacemaker of the heart. Again, the pacemaker is a cluster of cells that will rhythmically send out electrical signals that would determine how fast your heart beat. So that is the sinoatrial node or the SA node. Thank you, Donna. The speed of blood flow is dependent on blood pressure. We just wrote it down a moment ago. And vessel diameter. Higher blood pressure, faster. Wider diameter, faster. Cardiac output is calculated by multiplying heart rate and stroke volume. If someone has a heart attack, for example, some of the heart muscle might become weaker now. So they're not able to squeeze as much. So their stroke volume might be lower, which in turn will lower the cardiac output, right? Blood pressure is typically lowest in, we did a graph earlier, right? And so the answer for that would be veins. The speed of blood flow is typically lowest in capillaries because you have to slow down for diffusion to occur, right? For gas exchange to occur. ECG or electrocardiogram is a graphic record of the electrical impulses in the heart. Okay, it's a non-invasive, right? If you Ever seen it on TV or you had it done on yourself? You just put a button that the nurse would just put some stickers, right, at various locations in the body, and then those in turns would be hooked up to wires, and you know, you'll be able to see the electrical signal on the monitor. The hardening of arteries due to buildup of fatty substance is called atherosclerosis. Atherosclerosis. Supply the heart muscle with oxygenated blood. That would be the coronary artery. For liver, it's hepatic. For kidney, it is renal. Name the two phases of cardiac cycle. We have the systolic and the diastolic. Oh, sorry. The two phases, systole and diastole. When we say the pressure, then we change it to adjective, I guess. So that's systolic pressure when the ventricles are contracting, and diastolic when the ventricles are relaxing. Okay, that's the fill in the blanks. All right, do we have any requests for the long answer questions? I asked you to look through them and see if you have any request. A lot of them are pretty self-explanatory, but anyone want me to take up any particular question? I'll give you a minute or two to read through them, and you can just type in a chat box if you have a request. Victoria, request number 7. Sure. Number 7. Number 6, okay. All right, let's do those first. Well, number 6 describe how blood pressure and velocity changes in different blood vessels. That's basically the graphs that we did, right? Okay, so I'm gonna go back here just to see. So for blood pressure, it goes down as we move further and further away from the heart, because the heart is the source of the contraction, right? So that means the artery is gonna have the highest blood pressure. If you think about, you know, like a tap, right, and you hook it up to a hose, okay, the further you are away from the hose, the lower the pressure, right? If you poke holes in the hose, it's hard to say, then what happens is the water is going to leak out, but it's going to shoot the highest closer to the faucet, right? Okay, and when you go all the way over there, then it's just going to be lower, right? So similarly, blood pressure is like that, right? The faucet, it's pretty much the heart, and then this would be the artery, these would be the veins. So as you go away, it's going to get weaker and weaker. And for velocity, right, you will slow down enough to in the capillaries for gas exchange, but as soon as you leave the capillaries, the vessels open up again, right? There, it's going to be wider, and then the speed is going to pick up, and that's why it's coming back up again in the vein. is there a particular aspect of this question that you want me to clarify, Mohammed, or did I explain?
What does it mean by different blood vessels?
Oh, different blood vessels. Yeah. So like in arteries, in capillaries, and in
capillaries,
veins. Right?
Yeah. Vein, yeah.
Yeah.
Okay, thank you.
Okay.
Awesome.
Number 7, describe what happens in atherosclerosis and explain its relation to coronary artery diseases. Okay. So the atherosclerosis, right? Let's talk about what that is first. So here is a blood vessel, and you know, blood is gonna flow normally like that. And I believe I told you in the lesson that blood vessels, blood, they don't like to pass through a rough surface. Okay, the inside of the blood vessel is very smooth because of the endothelium. Okay, all these cells that forms the inside creates a smooth surface. But you know, if you have a diet that has high cholesterol in it, for example, a high lipids intake, what happens is some of these fatty substances, they start to build up on the inside of the blood vessel. Okay, like that. And they might build up a little bit here and there. And once you start to have a little build up, then as the blood passes through these areas, it's no longer a smooth surface, right? So that initiate blood clotting as well as a little bit of inflammation. Okay, so you're gonna have a little bit of blood clot here. Okay, so that's blood clot plus inflammation. Okay, and as soon as you have a little bit of blood clot, it actually will make the situation worse because now it's like even less smooth than before, and you're gonna have a bigger buildup and bigger buildup, so on and so forth. And because of these, all these build up, all these plaques that are building up, it makes this area really, really weak, right? And it loses its flexibility, and that's basically what atherosclerosis is. Okay. Sometimes, like, I mean, this could actually happen and anywhere in the body, but it's particularly dangerous if it happens like in the heart, for example, because you can cut off blood supply to the heart muscle, right? This could also happen in the head, and you know, it could cut off blood supply to the brain and resulting in a stroke. There is also something called aneurysm. Anybody know what that is? Aneurysm. Anybody have heard of that before? So that yeah. Do you want to explain what that might be, Donna, or you? Oh, sorry to hear that.
She survived, but she had, it's like a clot, right? Like a buildup, and she had a brain aneurysm. So I don't know if that's the same thing that you're referring to.
Yeah, so yeah, it's very similar, right? So aneurysm is probably like maybe one step further. Let me try to spell that again. Doesn't look right. YSM there. So when there is the atherosclerosis, it causes the vessel to be weakened in that area. So what happens is, if there is some kind of external trauma, let's say the person fell and hit the head, that external force would be strong enough sometimes to cause this weakened part of the blood vessel to rupture suddenly. Okay, so if this happens in the brain, then you know the blood's gonna leak out, and basically you're gonna have bleeding in the brain, right? And that could be fatal. The scary part about aneurysm is sometimes people would be totally fine, but all of a sudden that external trauma, you know, maybe you bump your head, like I said, or it could just be even if you're wearing a helmet or something and fall, that little bit of force sometimes would cause it to rupture, and out of the person nowhere, the person would, you know, would die from something like that. So quite scary.
Sometimes it doesn't even be a trauma. The doctors told my mom that she could just be walking one day and it will just feel like someone hit her over the head with a baseball bat.
Mm-hmm.
and then it could basically kill you instantly. So the only reason why my mom figured out that she had one is she was getting really bad migraines and kept pushing the doctors to look further and keep doing tests because her migraines were so unbearable. And that's when they found the brain aneurysm. So it wasn't even having to be careful of not to bang her head. They said, you know, they were getting her in for the surgery, but they said in the meantime, if like it could just be you're walking home from work and it just feels like someone hit you over the head with a baseball bat and you have to get to the hospital immediately or there's no hope for you. If there's
Yikes.
hope at all, right?
Right. So like would she be on some kind of blood thinner and things to lower the blood pressure, that kind of stuff?
She was on different medications. It happened rather quickly. It's just she had to make the decision. She fell in the age gap. So if you're, I believe it's if you're under, if you're like 25 and under, they do the surgery, no questions asked. If you're above 65, they won't do the surgery at all. She fell in the middle of it. So it was her decision. So it was basically like she had to decide, was she going to have this surgery to remove it or not? And then she decided to have the surgery. And then so it was very quick after that. It was just getting the process and getting the appointment booked. But I do believe, I don't know if they even had her on blood thinners because I don't think they wanted it to move. They were just monitoring it and trying to maintain with her migraines. But myself, I had a blood clot and I was on blood thinners for a very long time. Yeah, but with that, I think they didn't want it to move. That was the fear of it, was it moving if they gave her blood thinners, right?
I see. Well, thank you so much for sharing. It is scary stuff. So the coronary artery disease, right? How does this relate? Well, what we were talking about with aneurysm, we're talking about the brain, right? But the coronary artery disease, we are talking about the heart. Okay, so what happens is CAD, right? We could have one of two situations here. Okay, we can have a partial blockade. Okay, and then we might have like a complete blockade. So if it's just something like this, then the blood can still go by, okay, but it's reduced blood flow. Okay, something like this we call it stenosis, right? I think that's in the notes, stenosis, the narrowing of a blood vessel. So blood can still go through. So normally you might still be okay. But when you physically exert yourself, like if you lift something heavy, or if you're like walking up the stairs really quickly, then your body demands extra blood, right? To in order to supply enough oxygen for that, you know, extra boost of lifting, or extra oxygen for running up the stairs. And all of a sudden, this reduced blood flow is not going to be sufficient, right? Especially for your heart muscle. So when you physically exert yourself and you have a partial blockade, you might experience angina, right? Which is chest pain, right? And so what happens is people with angina, they might take an aspirin, right? Which will help thin the blood. There are other blood thinning agents like warfarin or something like that that would cause it to for the blood to flow past these narrow blocks easier. What's another drug that that we could take? Do you guys remember that I mentioned in class? Start with an N. Anybody got that far in the lecture recordings?
Is a diuretic.
Oh, diuretic is for high blood pressure. Yeah, but this one would be
myocardial infarction.
That would be like when you get a heart attack.
Yes, complete block. Yes.
Yeah. So this is a nitroglycerin. Okay. Yeah. Thank you, Ryan. I think Donna was also on the right track. Nitroglycerin, right? Remember, the nitroglycerin is in the lecture I said it's like an explosive, right? Actually, it was used as an explosive, but somehow they figure out there's medical use for it as well. This one, it used to that they put it under the tongue, right, and it slowly dissolves, and that opens up the blood vessel. This is actually a vasodilator. Okay, so these are some of the things that people can do. And surgery wise, you can do angioplasty. Yes, this is like in the part 5 of 5 of the lecture recordings. All right, I was looking at the how many people were looking at the recordings, because I can see who watched the recordings. The first part, a lot of people watch it, and then it just kind of dwindles as you go down to the last part of the recording. So if you haven't finished yet, please do so. It's kind of like the blood pressure, it goes down as we go along. In any case, we have complete blockade on the other end, which is, when this thing is totally blocked up, and that could be bad news. Okay, it could happen all of a sudden without warning, and so that would result in a heart attack, the MI, right, that you were talking about, myocardial infarction. And what can you do at that point? Well, hopefully, someone's nearby to call 911 for you, and at the hospital or even on the ambulance, something they would give you something called like a clot buster, right? That will dissolve the clot. They administer to you intravenously, dissolve the clot and reduce the blood flow. And for long term, you might have to do coronary bypass. Okay, and it depends on where it happens as well, right? So like, if you think about the coronary arteries, they branch out substantially like that, covering the heart, various parts of the heart. So if you have a complete blockade, like at the end right here, it will only affect like a small area, right? So that might not be as bad as having a block like up here. Because if you block this area, then everything downstream is not going to get any blood supply, right? And then this would be a much bigger area that's being affected, right? So it depends on the location as well. In fact, my dad, he did an angiogram because he was having discomfort in the chest, and the doctor found out that he had multiple terminal blockade. Okay, so at the ends of these coronary vessels, several of them were blocked. But they say it's part of aging. Okay, there's nothing you could do. They wouldn't open up the heart and do surgery for something like that. Okay, because it's obviously opening the heart to do surgery is very dangerous in the first place, right? There are a lot of risk factors. So as we age, sometimes it's normal to have a little bit of blocks at the end, but we definitely do not want them happening very early on in the branch, because it could affect a much bigger area. So that's CAD there. Hope that answers your question. Was it Victoria? I think it was Victoria. Okay, number 8, explain why someone suffering from hypertension should lower their dietary sodium, right? So again, this has to do with the whole concept of osmotic pressure, right? Let me just find a good spot to draw that out again. So here's your blood vessel one more time, right? And normally you would have these solute inside, right? And then you have some solute outside, right? And that creates the osmotic pressure, right? Drawing the fluid into your blood vessels like that, okay? Now, what happens is if you continuously increase your salt intake, okay, we're not talking about just having one bag of chips, right? That's not gonna do much to your blood pressure. But if you consistently, right, have a high sodium intake, right, then what ends up happening is you will now have extra solute in your blood, right, because of these extra sodium, and that would cause the osmotic pressure to increase further, right? Which would ultimately increase water retention, right? And that equals increased blood volume, which means increased blood pressure. So if you have high blood pressure, you don't want this to happen, okay? You want to stay off from the salty stuff. Okay.
So you mean water retention, like the fluid go inside the vessel, right?
Yeah, exactly. Which would, and then it stays there, right?
Yes.
Yeah. So actually, on a different note, sometimes people go to the hospital and then they give them like a bag of stuff, okay, and then it hooks up into their arm, right? Okay, so that bag of stuff could be many things. Okay, so if the person cannot eat because, you know, for whatever reason, okay, maybe they need to rest, or because they have some after surgery or something they cannot eat, then that could be like a glucose fluid. Okay, but in some cases, what happens is if they come from like a car accident, and then they lost a lot of blood, and then their blood pressure is dropping substantially, then you know, they might give them saline, right? I think I talked about this in last semester, right? They might give them a hypertonic solution, right? Saline, and one of the reasons for that is because if you infuse with the saline, that actually will increase your solute concentration, and that will help bring fluid from the surrounding area, which would then increase your blood volume and increase your blood pressure. Okay, so it really depends on what you're trying to achieve here. Does that answer your question? Number 8, Sandy, right? I think, yeah. Okay. So we have 2 application questions here, and you know, I'm just gonna explain it, and then we will do a multiple choice on it. That probably will work best. I probably don't have enough space here. Let me just grab my snipping tool. Give me 1 second. Just gonna copy this, and we will put it on a new page. Okay, so here, congestive heart failure, which is something that we have not talked about at all in the lecture, which is why it's an application question, right? Okay, it's supposed to be something that you haven't seen, but you have all the knowledge required to answer the question. So let's see. Congestive heart failure, or CHF, occurs when the ventricles fail to empty its content completely. Speculate what happens to someone if CHF occurs on the right side of the heart, okay, and then what happens on the left side. So let's draw this out. I don't know why we keep on drawing the heart like that. You probably know it doesn't look like that anymore, right? So this is right atrium, right ventricle, left atrium, left ventricle. So let's see. Right side CHF. Right congestive heart failure. Okay, so what does it mean again? Well, the question tells us it fails to empty its content as in blood, right? Okay, so when the right ventricle squeezes, instead of everything going to the lungs, there is some blood that's going to be left behind. That's what congestive heart failure is. So you will have some blood that's left behind. Okay, now why does that happen? Well, it could be a couple of reasons. Maybe the person is recovering from heart attack, so the ventricle is weaker now. It's not able to empty as much. It could be congenital, meaning the person is born with a defective heart, so they're not going to be able to empty it. Okay, so you will have some blood that's left over in the right ventricle, which means when the right atrium tries to empty the blood to the right ventricle, it also will not be able to empty completely. Right? Think of it like traffic jam, right? If this is all blocked up, all jammed up, it's gonna have backlogs, right? Okay. And then what happens is it means the vena cava that's trying to feed blood into the right atrium, they also will not be able to empty. Right? So the superior vena cava will not be able to empty, inferior vena cava will not be able to empty. So what does it mean? Well, all the blood that's coming from the bottom of the body, right, like here, right? They try to go back up, but they can't because it's blocked up. So now you will have blood starting to pool at the bottom of the body, right? Okay, so that would result in swelling of the leg. Okay, very severe swelling. Okay, in the case of right congestive heart failure. Does that make any sense? You guys with me?
Yeah.
Yeah, everyone else okay as well, I hope. Okay, let's see here. Okay, this question asks you what happens if it's on the left side. Okay, I just explained to you what happens on the right side. So can you try to see what happens? Speculate what happens if congestive heart failure occurs on the left side. Okay. All right. Just maybe a couple more seconds for people who still want to participate. All right, so if it happens on the left side, then that means blood is going to be pooling here, right? It's going to be pooling on the left atrium. And then we have to think about where the blood is coming from, right? In the left atrium, the blood is, of course, coming from lungs, right? Because of the pulmonary vein. So now you will have backup all the way in the lungs. So all these extra fluid, instead of building up in the legs, it will be building up in the lungs. And so the correct answer would be fluid accumulation in the lungs. Okay, so that could affect your breathing, that could increase your chance of getting infection like pneumonia. So pretty bad stuff. Okay, let's try one more. This is another one here. Okay, I'll let you try this one. I'll be so maybe it's a good idea to review what the ECG is showing. Okay, so over here, okay, I'm gonna end the polls. Okay, so over here, this first peak, that corresponds to atrial contraction. Okay. This part here from P to Q, okay, this little part here, that's waiting for the signal, the impulse. Impulse is a signal, right? This impulse is traveling from SA node to AV node, right? And then over here, this peak here, that corresponds to ventricular contraction. Okay, so here a heart block occurs when there's an interruption in the conduction system. Right? So the normal conduction system is from SA node to AV node and then to the Purkinje fibers, right? And so when you interrupt this flow of impulses, then we have what we call a heart block. So here, a first degree heart block is when the SA node to AV node is delayed. So what would happen to the ECG? Well, based on what I just told you, right? It would be a longer than normal PQ, right? So over here, first degree heart block, right? The longer interval between the P and the R, because it takes longer for the signal to go from the SA node to the AV node, right? And as a result, that would be a first degree heart block, right? So it's not a physical block, right? It's just an interruption in the electrical signal. Okay, so that is that for lecture 1. Does anyone else have any questions and comments before we go? Everybody okay for this week? All right, so next week we will meet again on Thursday and we will be doing lecture 2. And lecture 2 is quite complicated, especially if you have not learned it before, okay? It talks about the blood type and then the blood transfusion and all that stuff and a little bit of genetics as well. So please, okay, please watch the video before you come. Yeah, and I'll see you next Thursday, okay? Have a good week. Thanks for coming. Bye now.